You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today joins me from Melbourne in Australia. She is Angela Quero. She's the General Manager of Spectrum Migrant Resource Centres, Aged and Disability Services. Now, we wanted to talk to Angela for two reasons. We talk to a lot of people in aged and disability services, but we thought it would be interesting to talk to someone in the migrant resource space, and Angela's our first guest in that area. Angela, welcome to Health Professional Radio.
Thank you, Wayne. Hello, how are you?
I'm very well, thank you. Now, it's a pleasure to have you with us, and thank you for your time. Can you fill in for us what it is that you do and what it is that Spectrum Migrant Resource Centre do in the aged and disability services space? And can you also give us an idea of where you do it, how big the geographic footprint is?
Sure. Spectrum MRC is located in Preston, in Melbourne, in Victoria, and we generally operate in the northwestern suburbs of Melbourne. It has an amazing history, starting off as a migrant resource centre 35 years ago, and obviously changing over the many years, and probably now primarily has changed into what's now an aged and disability service, although we still do quite a lot of settlement and provide settlement and family services as well to newly arrived and emerging communities. My role here at Spectrum is quite a varied role. I am the General Manager in charge of delivering aged and disability services through a number of different programs, particularly funded programs, to older people and people with disabilities who are from culturally and linguistically diverse backgrounds. We have a very strong focus on assisting the carers as well of those older people and people with disabilities, simply because we think it's important for families who are the primary supports for people from core backgrounds. So we run in a very collaborative and co-design kind of way with families. So we work out what's happening within the family unit and what kind of supports would best suit the individual families. So our focus is both on disability services and primarily older people, so letting older people know that their children, who are now probably in their 40s, many of them in their 30s and 40s as well, can now be looked after, or we would work with the families to try and ensure that whatever supports are provided are relevant to their family, and then also in the aged care space. We provide a lot of respite support essentially because there are a lot of carers out there who are now home-based and they don't get the opportunity to go out and look after themselves, go and seek their own medical appointments or have some free time, do their banking, shopping, etc. So we'll be the ones that send a worker who is obviously a bilingual and bicultural worker to the home and provide that break for the carer. On the other hand, we also have a fee-for-service-based service called the Multicultural Home Support Service, where we have hired about 180 support workers who work across the northwest area in Melbourne, now also in the southern suburbs, I must say, and we're able now to provide care to about 400 clients across Melbourne who are recipients of home care packages.
Angela, it sounds like a very big undertaking. Can you give us a sense of how big the organisation is, maybe the number of staff you have or the number of clients you have? I was just trying to share with the audience a sense of how big an organisation it is.
Yeah. Our organisation here is about 290 staff, and we have 3 locations. So we have our offices are across the northwest, and we probably have in total about close to about 600 clients in total. That's across our settlement and family services area as well as our aged care services. So you'll find that in a lot of our programs we also partner with organisations to ensure that we're being relevant in terms of the way that their own community programs are developing as well. So we run programs for newly arrived. Our Parenting in a New Culture program is something that we're really pushing at the moment. And in our disability space, we have what's called our Connect groups, where we run particular groups for people, older people with disability who want to get together and have and make social connections. Mm-hmm. And we also have what's called our centre-based respite programs that operate in 2 2 locations across Melbourne where we have every day we have a different ethnic group. A group of older people from, say, the Italian community will come together and spend the day together. We'll cook them a wonderful meal. Totally different staff will join them every day, and they'll run activities and, just break the isolation. They'll go on outings and, have generally a good time, and that gives their carers at home a break.
Yes. Angela, many of our audience, in fact about 95% of our audience, are clinicians of one kind or another. We get lots of people in acute care, and we get lots of people in aged care. Is there a message you'd like them to get as a result of having heard you on Health Professional Radio today?
Absolutely, it is. Currently, I suppose one of the issues for us is the concept of consumer-directedness, and the concept of consumer-directedness in terms of saying, well, what does this client want and how can they best communicate that? In most cases, an important issue to remember is that keeping the concepts really simple, ensuring that there is a simplified version of the information that you're giving your clients, and giving them time to make that decision. If you're in a position with an older person where you're needing to get a decision made very quickly, it can be incredibly overwhelming. One of the things that does frustrate me sometimes is to hear that, we don't need to know, we no longer need to ensure that information is made available in different languages, and that's just not true, simply because, what we find continuously is that making information available in different formats, whether it's photo, images, overdubbing in different languages, is so important, simply because there are different ways that people from non-English speaking backgrounds, get information. The verbal is important, but to back that up with something which is, a simple Australianised version of the language is really important as well. So, for example, trying to translate the concept of choice and control is really difficult if you're, talking with somebody who doesn't really understand that from a personal perspective anyway. So if you're an older person and you rely on your children to make the decisions for you about how you will, spend your packaged care funding, asking that person without the presence of their children on how they would make that decision is almost a moot point. You're really not going to get a true indication of what their needs are. So there are still, I think, some areas where we need to be really sensitive about who's available. How much time can I provide somebody to make a decision, and providing the choices and the options rather is so much more important than asking for a time frame where that the information can be returned. Health literacy continues to be an issue for people from non-English speaking backgrounds. We're still struggling in terms of ensuring that information is available in different languages, and the use of interpreters is absolutely essential. Yes, it does take longer. There is a cost involved, but it will pay dividends. If we want everybody to have a say in the way that their care is being delivered, then we owe it to them to ensure that they're able to be full participants in that kind of, in that kind of relationship.
If you've just joined us, I'm in conversation with Angela Quero, who's the General Manager of Spectrum Migrant Resource Centre's Aged and Disability Services, and we've been talking about the work that's done by the Migrant Resource Centre, and in particular, the Aged and Disability Services. Angela, when you're thinking about the work that you do, I guess it's a lot like every other profession and occupation around. There are misconceptions that drive you nuts and keep you awake at night. What's the biggest misconception in your work that drives you nuts and keeps you awake?
Well, one of the things I do that does concern me is whether or not we really do understand the need to ensure that people have the opportunity to stay at home, to be cared for at home. This isn't something which is relevant, obviously, only to people from non-English speaking or CALD backgrounds, but certainly that concept of being supported to stay at home is absolutely essential. And I often wonder about how else are we going to get the message out there that Spectrum is here, that we have a number of programs that are available, and how do we get that message out? So, it's important to me to try and understand what are the barriers that prevent people from knowing about our services, and how else can we do it? How else can we get to people to let them know that it is an option? Staying at home is so important, because home is where our memories are, our families are, it's safe, I feel confident, I have my pets, etc. The connection to home is so important in so many cultures. The concept of an institutionalised system which is provided by the state, or that care can no longer be provided in the home, it's just not relevant in so many cultures. So, to have the service which is, like 160, 180 support workers speaking 50 languages is so essential. And we really think that, called older people deserve to be looked after by called carers, people that speak their language and understand their culture. So, I often worry about, why aren't we getting, people through the door, and how else can we get the message across that this is an important part of that journey to, through our old age. And I think respecting that and ensuring that it continues to be included in our policy development, the policy direction, and it's a priority for people to ensure that their preferences are respected. That's what sometimes, I'll wake up in the middle of the night and go, well, what else can we do? Have we done enough?
Well, with a little bit of luck, we can help extend that message a little bit today, Angela. Thank you very much for your time today. I do appreciate it.
Thank you so much. Thanks, Wayne.
Now, if you just missed my conversation, I've been chatting with Angela Quero, General Manager of Spectrum Migrant Resource Centre's Aged and Disability Services. And if you'd like more information, you can head off to www.spectrumvic.org.au/aged-care. If you just head to www.spectrum, SPECTRUMVIC, all one word, spectrumvic.org.au, you'll find the links there. Also, on our website, on the Health Professional Radio website, you can find a transcript of my conversation with Angela. You can also find links to an audio archive of the interview, both on YouTube and on SoundCloud, where you can listen to the whole thing again. Or if you've missed it the first time, you can listen to it for the first time. You're listening to Health Professional Radio. The website's www.hpr.fm. My name is Wayne Bucklar, and thank you for joining us today on Health Professional Radio.